Okay, I wanted to record. It said I need to ask permission from the host. So that's fine. We'll use your recording. That's no problem. So good morning, everybody, and welcome back to the Ursula Salon show. This is our second edition. It was a couple of weeks ago. We spoke to an amazing lady called Susan from Mobilities, and we'll be seeing more from her from a wellness perspective and what the future is holding for people, especially like working on their feet all day, and an industry which is very dear to my heart, which is the hairdressing industry. So today I'd like you to welcome, please, Dr. Zano, and he's from Info Wellness. So Dr. Zano is a chiropractor, and he has a list of qualifications and achievements from years of study and experience, both locally and abroad. So welcome, Zano. Thank you for joining us.
Thank you, Ursula. It's great to be here, and thank you for doing this podcast, and hello and welcome to our listeners. So yeah, I am really happy to be on board today, and I thought that maybe we could just share a couple of things which would commonly interfere with hairdressers, and maybe your ability to lead a happy, healthy life and your ability to generate lots and lots of income. So we'll go through a couple of things that mainly I think would affect hairdressers, and where I think we can maybe add some tips and tricks and help you get the most out of your lives.
Okay, that sounds really cool. So one of the challenges, what are some of the challenges with and pain that pain points that hairdressers experience? So the one I've heard of over all the years is Carpal Tunnel Syndrome, CTS. So maybe you can tell us about that a bit today.
Yeah, sure, Ursula. So yeah, you're quite right. I mean, there are general sort of occupational risks for most type of positions that we'll have in any job. So sitting is a big factor where it comes to office workers, etc. But hairdressing has its own specific occupational hazards, for lack of a better word. And one of them, as you correctly mentioned, is carpal tunnel syndrome. So carpal tunnel syndrome, it sounds really terrible. I'm always reluctant to have a diagnosis that has the word syndrome in it. It feels like, oh my gosh. But carpal tunnel syndrome is really just an entrapment of the median nerve as it goes through this canal here. So more often than not, that will happen on your dominant hand, or the hand you use the most. And there's like a little canal, and I'll actually just share my screen, because there's a lovely picture that I have that I can show you with that.
Great.
So I'd selected this picture initially as a kind of title, because it's it really is one of those things where you'll almost feel like you're trapped by a condition, and hence that picture. And it really doesn't have to be that way, because there's quite a lot that you can do for it. But I'll just pop on back to the cause of carpal tunnel.
Okay.
So this area over here, you can see this fibrous band going across, and then this is the median nerve, which goes through that into the hand, and it supplies the sensation and motor coordination to the three fingers on the outside of your hand. So if you're standing up in the anatomical position, this would be the outside of your body. So it's these three fingers, the thumb, index finger, and the middle finger. And the very important thing with this is that it not only supplies sensory nerves, but also motor nerves. So a lot of times, one of the first symptoms that people have is a lack of strength in those particular fingers and the muscles that supply them. So as you know, with hairdressers, it's really important that we have our fingers working optimally, so we can snip those scissors. And it is one of the occupations, like my occupation, that does rely quite a lot on the hands. But where probably one of the biggest areas of confusion is with carpal tunnel is that there's only this little bit of nerve that is trapped underneath the fibrous band in the hand, but the actual nerve extends all the way from the neck right down into the fingers. So if you look at the diagram on the left hand side, you can see the course of the nerve, and that starts off way up in the neck. So as part of like a normal chiropractic adjustment and session, what we would do is we'd look at the whole course of the nerve. So we just want to make sure that it's not just locally affected, but that it's alleviated all the way up the course of the nerve.
Okay, so from that point of view, then what does a chiropractor do, like particularly to take the pain away? You know, what are the options?
Yeah, so it's quite a wide-ended question, that Ursula. So the first thing that we would do is we'd do a thorough history and examination. So obviously there's a lot of other conditions that can manifest as carpal tunnel or that we might need to rule out. Where we're very different from a medical or surgical perspective is that we want to try and get to the root cause of the problem and also then preventing the
Yes.
problem from reoccurring. Because one of the things that they've found is that people that are predisposed to this have a very small canal in the wrist. So it's one of the things that might make them a little bit more susceptible to developing carpal tunnel in the future as a recurrence. So we would do a physical examination, we'd do a neurological assessment of the nerves so that we can map and see how much of the nerve function is affected. We'll also do some strength testing, which will go and determine, we do it simply like that, just opening up and seeing how much strength has been lost, if any, in the nerves and in the muscle. That's often a way for us to be able to assess how much dysfunction has occurred. Because the interesting thing with the carpal tunnel is that pain itself is actually quite a later symptom. You often find the weakness and numbness and tingling first before you find the pain. Then once we have established that this is in fact carpal tunnel, we will begin adjusting the person. And I personally, in my practice, use head to toe adjustments. So literally every single condition that somebody comes in for, I will look at the entire spine. So do an assessment from the head right the way down to the sacrum and make sure that all the individual vertebrae are moving there. And
Okay.
carpal tunnel is actually quite a good example of that because the median nerve that's affected comes off 3 or 4 vertebrae. So it's often difficult to say it's exactly this point we need to treat the whole spine.
So what are then some of the risk factors of developing carpal tunnel syndrome?
So as we've mentioned, overuse is probably one of the biggest factors. And the other factors are things like pregnancy, inflammation, and anything else that's going to make that gap a bit smaller. What we were trying, so the treatment is focused on a couple of levels. So we want to try and open that gap so that the nerve can pass through unencumbered. And then we want to put more flexibility and movement into the spine so the inflammation decreases.
Okay. And is it more prevalent in different people than others, based on gender or age or how long you've been doing a specific task?
Yeah, so it does occur more with overuse. So I've got another little slide for that. So I'll just pop that up onto my screen again. So we've got a couple of risk factors. So yeah, as I've mentioned, having a small carpal tunnel. Being female, unfortunately, as it was Women's Day today, this is something that I don't wish upon women, but unfortunately women are more at risk. Pregnancy, breastfeeding, anything that's going to increase general inflammation in the body and narrow the gap. Increasing age, as one gets older, what happens is that the tendon that goes over that area becomes a little bit tighter and less flexible. Then obviously any wrist injury or trauma. So if you've ever fallen on the wrist or damaged it bad in a car accident or fall or from repetitively catching the ball, it's also a risk factor. Then rheumatoid arthritis, diabetes, and any other neurological order that's going to be affecting the nerves will naturally affect that nerve as well. Vibration is one. So, you know, we often have these little handheld massages or clippers, and that is, again, something that can predispose it to it. And we've mentioned the work-related aspects.
Oh, that's very interesting. And then if it's cold as well, I think in the cold weather, people suffer more from it in winter.
Yeah, so generally chiropractic practices are quite busy in the colder months because we see that there's a big decrease in blood flow. So chiropractic, really, a simple way of thinking about it is it's about increasing the blood flow and increasing the neurological responses of the various tissues. So that's one of the things where we find that we do generally get quite busy in the winter months. So yeah, cold weather, like most things, does aggravate this.
Then how do you've touched on it a little bit, but how do you actually do a diagnosis for it?
Okay, yeah, so there's a couple of tests. So what we do firstly is have a look at the spine, as I mentioned, and we use a technique called motion palpation, where basically we're looking at the vertebrae, literally feeling and looking at how they move. Then there's a couple of specific tests that we'll look at for the carpal tunnel. So it will be things like testing the nerves. So we do one which is Tunnel's sign test, where you just tap on the nerve and you want to see if that reproduces the pain. There's another one called Fallon sign, where you go into that position and hold it for 60 seconds and see if you can reproduce the symptoms that the person has. As I've mentioned, you also look at the strength test, so see if you can pull the fingers apart. We'll look at reflexes and also something called 2-point discrimination, which helps us determine how much nerve damage there is. And that just consists of us putting 2 little pinpricks on and seeing if you can determine whether that's 1 pinprick or 2 pinpricks.
Okay, so there's a chance that even if somebody has some of this pain, that it might not be carpal tunnel syndrome. Is that correct?
Yeah, it can be the case, very much so. So there might be a variety of other things that we need to have a look at. You know, that's part of the diagnosis. So we do find that there are a lot of instances where people do have also more than one condition. So, you know, you can have carpal tunnel with something else, so diabetes. So one of the things that I've become more aware of lately is that actually there's 30% of the population is undiagnosed diabetic. So oftentimes carpal tunnel syndrome may indicate a more serious underlying disorder, and the carpal tunnel is the first indication that they get that they've got that disorder.
That's very interesting. So then how do you treat carpal tunnel syndrome?
Okay, so chiropractically, what we'd do is we'd have a look at the neck again, the spine, and make sure that all the vertebrae are moving correctly, because that is an area where they do become entrapped. Then we want to trace the course of the median nerve all the way down. So we'd begin by mobilizing the elbow and mobilizing the wrists as well. So a lot of our treatment is aimed at increasing the size of that canal and providing more flexibility into that wrist area. Sometimes what also happens chiropractically is that some of these bones move out of position in the wrist, say following a fall, and we can actually adjust those and realign those and put them back into position. And that's very effective if that is what the cause is. You'll often hear quite a loud click as that bone goes back into position, and the relief is almost instantaneous. And then there's a couple of things that we need to do at the same time, which is just about decreasing the inflammation and making sure that the nerve damage gets reversed, because you can actually reverse nerve damage provided it hasn't gone too far.
Okay, well, that's very interesting. That's good to know, because you need to get back to work and doing what you were doing. So it's good to know that it can be fixed and not necessarily it's a permanent condition. So what does physical therapy the pain?
So just say that again.
So how does physical therapy, what does it look like? How do you actually work? So if I was a patient, how would you actually stop the pain? Are you going to be doing physical treatments on me? Are we going to be taking medications, or like what is the process?
Yeah, so there would be a variety of different things that we would use. So one would be mobilizing the wrist, just making sure that it moves quite nicely. There would be, there's often trigger point involvement. So what you'd find is that there's various muscles in the forearm that have gone into spasm. So what we might do for those is do something called ischemic compression, which is just pressing down on them and releasing them. We might put in a needle, like similar to an acupuncture needle, just to relax that muscle. And there's also quite a few dry needling points that we use. So a very common one is LI4, which is just a general analgesia point here. And we'll use that a lot for carpal tunnel. And in Chinese medicine, that's supposed to help the inflammation sort of disseminate. And from a chiropractic point of view, that helps alleviate pain and frees up the area. Then we want to make sure that there's good mobility. So part of our ongoing treatment would actually be to give some home exercises for people to do, to put an ice pack on, to maintain that mobility, to decrease the inflammation, and also things like strengthening it. So strengthening the forearms and the wrist is a very important part of the treatment. And that's not only for the symptom reduction, but it's for prevention in the long term. And it's also to make the wrist stronger so that now you can actually be more productive. So let's say if you were a hairdresser, you'd actually be able to do more cutting or more tinting or more handwork before it fatigued and before the symptoms started to develop.
And once they've sort of passed that process, is it something, because I would imagine there's plenty of people watching that have actually had it, to just maintain over the years to make sure it doesn't recur, certain exercises that they would be doing every now and then, or how often should they do that?
Yeah, so, as they say, an ounce of prevention is better than a pound of cure. So, yeah, it's definitely something that you want to be looking at. And particularly, as hairdressers, I would imagine, are quite busy certain days of the week, let's say. So the weekends, Thursday, Friday, Saturday is probably a big day. So you want to make sure that you're fighting fit for those days. So there's a couple of strengthening exercises that you can do. So there's a device called a power ball, which I'll show you a picture of that on here. I've got one.
Yes.
And the great thing about the power ball is that it actually increases the strength of not only the forearm muscles, but also opens up that canal to make it quite strong and quite pliable. This power ball is used by anybody that requires a lot of forearm strength. So actually chiropractors use it for part of their training as well as mountain climbers. So you can imagine for a mountain climber, it's really important to have a very strong wrist and forearm. So this exercise, I used to have one here, but I've actually lent it out to a patient with carpal tunnel. But it has like a little string and you pull it and then you have to move it around in your hand in that sort of movement. As you're moving it around in that movement, what it does is it provides traction on the joint. It provides mobility in the joint because you're spinning it around, and it also strengthens the forearm muscles. So that makes quite a big difference long term for it.
Is this an item that people could get from you if they wanted to? They could inquire in the comments below, or is it just any sort of something shaped that way? I'm assuming it's specifically made for that syndrome.
Yeah, so it is something that's available online. I can also source it for patients if they get in touch with me. And also places like Sportsman's Warehouse, etc., do keep it from time to time, just depending on whether there's any sort of stock availability.
Okay, that sounds fabulous. So, I mean, being pain-free sounds like an absolute gift. I mean, other than CTS, is there anything else you want to touch on CTS? And then maybe you can tell us some of the other pain points that hairdressers actually have.
Sure. Yeah. So I think that for CTS we've covered the CTS aspect quite well, and I think that we've got enough there for people to work with and be able to accelerate it if they want the next step. The maybe one thing that we haven't touched on yet is a little bit about surgery of carpal tunnel. So what often happens is that people will go to a GP or orthopedic surgeon with carpal tunnel syndrome, and invariably a surgery is recommended. Unfortunately, surgery has a very poor success rate. And I'm just going to go back to my initial slide for a second because I want to just explain something with that. So in the surgery, there'll be a incision made over this area here, the transverse carpal ligament. And that then is supposed to free up the nerve. But as I mentioned previously, this nerve can be impinged anywhere along the course of it. So it has a very poor success rate. So if anybody has been asked to have the surgery or it has been recommended for them to have the surgery, one thing that I would say is to please try and have some conservative management before that surgery is done, be it by chiro, physio, bio, whatever, because we not only find that it may resolve, but then also if surgery is required, the results of the surgery are much more favorable.
Okay, that makes sense. Okay, so then some of the other things that hairdressers do, I mean, these are people that have worked, some of them I know for decades, been standing on their feet and know about varicose veins and probably back issues and that kind of thing.
Yeah,
how can we treat them? What other things do they do?
So, I mean, back pain is a big one. So I think that, everybody suffers from back pain at some point. I think the last stats that I read was that 80% of the back pain was we would all experience back pain in some point in our life. Yeah, so in terms of other things, I mean, back pain is a big one. And one of the things that we find is that as research has progressed and I guess we become more victims of our sedentary lifestyle, is that our core is a big factor in back pain. So our core, basically, when you do exercises like the plank and other abdominal exercises, those strengthen the core. And when we're standing for long periods of time and we get pain across the lower part of our back, that is when it's a sign that our core is weak and we're unable to hold ourselves up. So I always get a lot of nasty looks and comments under people's breath when I tell them that they have a weak core, especially people that are very involved in gymnastics or go to gym every day, or big bodybuilders, and then I tell them they've got a weak core and they want to hit me. But the thing is that the core is very interesting, because most of us who do things like sit-ups, etc., work our core as a prime muscle mover. So that means it's used to active movement as opposed to holding us in position for a long period of time. So the simplest way to explain it is that most of us are training our muscles to be like a sprinter's muscles, the core, whereas we need the core to be like a marathon runner. So it has to do a low level of activity, but for a very long period of time. So there's a few exercises that I give to my patients in practice, which I won't be able to show over a Zoom session, but that's so they can strengthen the core. So a core is one of the most important things that you can do for yourself as a life preservation and health and well-being tip, because a lot of times as people get older, they fall, and that can be as a result of a weak core. General breathing needs a strong core. So in terms of back pain in general, we're moving a little bit out of the era of a disc. So I'm just going to share my screen again for a second. So we all want to have a nice and mobile back, and the core is critical. So this is what the spine should normally look like, and then this is what happens when there's a nerve entrapment over an area. This is what we used to be called in the old day a slip disc. So we've now, because of MRI, etc., we can actually see that there's a very small percentage of people that have a true slip disc. What most of us tend to do is have quite weak cores. And as mentioned, the core is important, as is movement in the spine in general. So if we have a look at this picture, it's helpful to think of the spine as like a mainframe computer that runs your nervous system. So as all the signals need to go up and down to the mainframe, so too they need to go up and down your spine into the brain, etc. So your spine coupled with your core is what's going to keep you upright and make sure that there's nerve transmission throughout your whole body. So I would say that those are probably the biggest tips that I could say. Keep your spine healthy and keep your core strong.
Okay, well, that makes absolute sense. I mean, we're so blessed to have a doctor of your caliber join us on the show, so thank you so much. I love that you always put your patients first and that you want to heal without surgery, and I think and medication. I think that's a great thing. So other than that, in closing, can you leave our audience with a plan of action to be pain-free? I know you've went into a lot of things, but just our normal lifestyle. So if we can't go to the gym to strengthen our core, or we are standing, what are some of the things we could do? Perhaps is walking going to be enough, that kind of thing?
Yeah, so I think that we were generally getting quite a decent amount of activity, some of us more than others pre-lockdown. But even from myself under lockdown, I saw that my steps went from over 5,000 a day to under 1,000. So this movement cannot be underemphasized at all. In fact, the World Federation of Chiropractic has said 2020 is going to be a decade of movement. So we know that if there's nothing else that we can do, if we can just get people to move more, it's going to improve not only their back health, but every single health measure. So, even walking for as little as 30 minutes 3 times a week has been shown to increase bone density and have a lot of other health benefits. So just, so I would say if you can maybe go for a little bit more than that. So if you can do 30 minutes of walking, brisk walking per day, it's golden. That would be the first thing that you can do, and that's going to probably have the maximum impact on your bodies.
Well, I think that's a very big help. Yes, continue.
Oh no, I was just going to say, and then from there, all other things will happen. So, you know, I always give my patients the analogy of a car that won't start. Once you start the car, then you can start to see where there might be other bits and pieces that aren't working, you know, a bit of knee pain here and there, a bit of shoulder pain, and then you can have those attended to in due course. But, you know, before you even start moving, you don't even know what's going to be happening.
Yes, I think, you know, just not being so inactive for the first 3 months, the hairdressers only opened on the 1st of July. I mean, sitting around, first of all, from a mental perspective is terrible. And then falling into, because of so much, everything that's going on, and almost like a depression, it's very easy to just like want to give up and lie on the couch. And I think a lot of us have done that over the time because of not knowing what else to do. So I think you've given us some really good tips today. And even if we can't go back to gym or anything now, at least if we start walking and start getting out and focusing on our core and try and find out a bit more about what that is and how that we can fit that into our lives and help with our backs. And we know that for the future, we'll chat to you a lot more about that. So Dr. Zano from Flow Wellness in Rivonia, thank you so much for being here today, a guest on our show, and you're going to become a regular guest. And we will have Dr. Zano's PDF on the Carpal Tunnel Syndrome available for download in a link here in this video. And we will be seeing him again sometime soon. And welcome any questions that you have in the comments. And if you want to contact him, it's info@wellness.co.za, if I'm correct. You know, with any questions directly via email. But thank you so much for being with us today. We're on the Ursula Brett Salon Show. We really appreciate your input.
Great. Thank you so much, Ursula. And thank you to the viewers as well.
Great. Thanks so much. Bye-bye.
Bye.